we're in the age of AI, remote monitoring. Remote monitoring has like completely taken over even cardiac failure heart
Mhm.
management as well. We've heard a lot about Cadence. What is your take on it? And is it really helpful in terms of cardiac management?
So as far as the Cadence program goes, I'm a huge fan. I have, worked with Cadence since the very start of their program and sort of helped them map out how we're going to, treat these patients. How are we going to communicate with the hospital? And I can't say enough about how great of the work that they do. So one of the things that sets Cadence aside that I think works very well in their favor, most of these patients, they either pick up in the hospital before they go home. So they're monitoring them even before they leave the hospital with us, or they get set up at their very first doctor's appointment after they leave the hospital. And the nice thing about Cadence is all of the monitoring that the patients do. So for a heart failure patient, you're going to get a scale, you're going to get a pulse ox, and a blood pressure. So every time you step on that scale and take a weight, there is somebody, like a physical person at Cadence, that monitors that. So if they see a weight gain that we're concerned about, they're going to call you. If they see a blood pressure change that is a concern, they're going to call you. Same thing, with your oxygen, your heart rate, all those things. There's somebody that monitors and they will call you. A lot of times, those numbers will indicate that you're about to have an exacerbation before you even feel it or before you know something is happening with your body. So it really enables us to be able to decrease hospital admissions, readmissions, and keep the patients at home. The wonderful thing about Cadence that I think really sets them apart from other home monitoring systems is they don't just have a person that can call you and say, "Hey, you gained 3 pounds last night. You should call your doctor." They employ nurse practitioners and they can do televisits with the patients, go over their signs and symptoms. They can adjust their meds or labs, anything the patient needs over the phone in many cases. So it's kind of, you have an extra set of eyes on you at all times if you want to look at it that way. And you have somebody that can really help change the course of, or the trajectory, I guess, of your heart failure and keep you at home while you do
Yeah, it sounds like a wonderful program.
it.
Complementing the cardiologist or heart failure
Mhm.
nurse coordinator.
Yes. And what's really nice on the hospital side, so with the Cadence coordinators that talk to the patients, let's say a patient, on Monday they had a weight gain, they got them into the office, they gave them some IV Lasix, they changed medicine, and it's still not working, and they have to come to the hospital. Those coordinators will call me and let me know. So I already know what we've tried at home. I already know where we are. So the communication and the teamwork, it carries over from home into the hospital seamlessly. So that has been a great help, especially when you get to the ER and we already know we've tried X, Y, and Z. So we don't have to do that again. We already know where we're at.
Hmm. So yeah, like it's like a lot of moving parts involved, but it
Mhm.
helps each moving part stay on top of each other, helping in the overall care of the patient. Then
Yeah. And
that
if the
that sounds
patient doesn't have any problems at home, they're not short of breath, their weights aren't changing, we're just in the background waiting.
yeah.
We don't do anything. So it's a little bit of comfort, I think, for patients and families to know that somebody's watching those numbers all the time. If you do need help, you can reach out or we'll reach out to you. But then you also are able to, keep your independence and be at home and do what you want.
The patient gets to stay in the comfort of their home and take care of themselves while the clinical team is doing their own work and side by side monitoring the patient as well.